Welcome to Graduate Medical Education at Prisma Health. Prisma Health partners with the University of South Carolina School of Medicine in Columbia and Greenville to offer more than 60 residencies and fellowships. With approximately 650 residents and fellows, we view education as integral to improving community health and are committed to providing the best training possible. Our clinical campuses prepare today's clinicians for tomorrow's healthcare. From our Simulation Center to Advanced Research and Innovation Center, we are on a journey to transform healthcare. As South Carolina's largest healthcare system, Prisma Health's unique collaborative environment fosters new solutions for care delivery, access, and affordability, all with the goal of helping people live healthier lives.
Because of our faculty diversity here in terms of training, with each area of expertise that they bring, we have such a culture here where they're intentional about sharing their level of expertise in a very humble way with a lot of our residents and our students. So as soon as residents are able to identify or think about some of the things they're interested in, our faculty are able to come together and support our residents and students to get them to where they're going next.
I'd say the collegiality here at Prisma Health really helps as the baseline for what goes on in the hospital. The fact that I'm able to go out and spend time with my other colleagues that are in family medicine, psychiatry, OBGYN, surgery, it really helps me develop relationships with them. That way when we're in a difficult spot in the hospital or a complex patient, we already have the background and trust in one another to make sure that we're giving the best care to our patients.
The residents are uniquely involved in our Diversity, Equity, and Inclusion Subcommittee. So we have 2 residents that sit on that group and meet with us monthly. The residents and fellows themselves have their own committee that meet monthly to develop their own initiatives.
Prisma Health has been a part of that in terms of understanding the importance of recruiting and retaining a diverse resident and medical student class to better care for and improve the outcomes of our community. That is clearly something that we take very seriously and that we're working to improve to not only make things better for our community, but also just to improve and diversify the face of medicine.
We formed the Diversity, Equity, and Inclusion Subcommittee off of the GMEC last year, and that group, we meet monthly. And out of that group, we've started several initiatives. One was a virtual open house that specifically targets minority applicants. The second is a Justice, Equity, Diversity, and Inclusion Award, or the JEDI Award. And so at our annual graduation ceremony, we now award residents as well as faculty members that have specific interest within the DEI workspace.
We see health and well-being as keys to success. Our culture of wellness sets us apart from other training programs.
We have resources like the EAP that provides mental health and other resources. We're also intentional about making sure our residents all have primary care providers, so that way they know where to go to if they get sick. And then in general, we just support a community where you should be able to ask for what you need, whether it's more time off or other ways to help support your life outside of medicine, that I think makes residency a little bit less challenging. And so Greenville is really intentional about that, and that's another reason why I'm so proud of this program.
Where you train is important when choosing the right program for you. Training opportunities abound in the upstate of South Carolina. From the bustling city of Greenville to small town charm of Greer or the rural appeal of Seneca, Prisma Health has the right fit for you. Prisma Health's Greenville Memorial Campus is the region's premier referral center and hub for our many residency and fellowship programs.
My wife and I did the couples match, and whenever she came up here, she fell in love with the city so much so that whenever I had my interview, she actually came up here with me. We got to go and walk on the Swamp Rabbit Trail, and she showed me the hospital, and she even showed me her department, the Department of OBGYN, whenever I was here, and we really felt like this is a place that we could call home.
Greenville is very affordable, with a cost of living below the national average, a thriving downtown, and seemingly endless variety of outdoor and cultural activities.
With the proximity of the hospital to local houses, it made it really easy to buy a house. We actually live across the street. We can easily stop by after work and go to different breweries or taco shops, or even go to an exercise class, go to a spin class, go hiking. There are a lot of really great things nearby the hospital that we can stop by and do.
If you prefer more of a small town feel, check out the charm of Greer.
Here at Greer, wellness activities and fun are very important to us. We've gone axe throwing, we've gone to the trampoline park, we've gone to the apple orchard, Topgolf. We do all sorts of things. So yeah, we take fun very seriously, but then we do also get together outside of work and, go to each other's houses and have dinner and Friendsgiving, different parties, different celebrations. We are, like I said, very much a family. All of my attendings have an open door policy. I could walk down the hallway right now and go into any of their offices and ask a question about work, ask a question about life. We just very much have the family culture, family vibe here. I think that leads to an awesome education.
Those wanting a rural training experience need look no further than Seneca and Oconee Memorial Hospital.
The city of Seneca, with its calm and tranquility and the beautiful mountains and the lakes that we have around, I think it's a perfect nature spot for someone who's close to outdoors and really enjoys doing a lot of stuff outdoors. This is a longitudinal family medicine program, which is exactly what I was looking for, because it does offer a lot more time in the clinic, and which is what I want to practice when I finish the program. I want to work in an outpatient setting, and the program provides a perfect opportunity to do that for me.
From primary to specialty care, Columbia to Greenville and beyond, Prisma Health offers a program and setting to satisfy most everyone. Our approximately 36 fellowship programs range from child and adolescent psychiatry, cardiology, and clinical informatics to infectious disease, primary care sports medicine, and vascular surgery. As for residency programs, nearly 30 are located between Sumter and Seneca. Wherever your clinical interests lie, Prisma Health will open new doors to one-of-a-kind training and career opportunities. It's no surprise that more than a third of our graduates stay in South Carolina to practice, with about 2/3 of those staying on at Prisma Health. Retention of graduates is a hallmark of our program, increasing access to care for the communities we serve. Prisma Health and the University of South Carolina School of Medicine in Columbia and in Greenville invite you to join our journey as we transform healthcare, one physician at a time. For more information, visit prismahealth.org/GME.